Hi, everyone. My name is Robert Ritlop. I work for MEDTEQ Plus. I am the Director of Investments there. Over here, why don't you introduce yourself, Marina?
Hi, Robert. Thank you for inviting me to join you today. My name is Marina Massingham. I'm the CEO of Aifred Health. Aifred is a digital health startup. We're based in Montreal. We are 4 years old and we have a long history of relationship with MEDTEQ. And our focus is clinical decision support in mental health. So we help doctors to make better decisions in the care of their patients in order to provide better quality of care, better efficiency of care, and of course, better outcomes for those patients. And we're starting in depression.
So that's a pretty big topic right now. Obviously, mental health is sort of all the rage in the venture circles, at least. How did we get here? I think one of the founders' names is David, correct? And so how did David sort of come up with this idea? And just give us a quick idea from where you started and where you are now. So just for the folks at home.
Sure. So today, as you say, there's a lot of interest in mental health and certainly a lot of mental health startups out there. About 99.99% of them focus just on the patient. And when Aifred started back in 2017, Dr. David Ben-Rima, who's one of the original founders, was studying at McGill for his medical degree. And he saw among his patients and their extended family members a real gap in the ability of physicians to effectively understand how to treat and address complex mental health conditions such as depression. So he saw a real need for doctors themselves to receive better support in terms of understanding where the patient is on the disease cycle, what to do next to manage those patients, and also how to effectively select from a vast number of available first-line medications, which exact medication would be right for that patient.
And so that's pretty big, actually. That's pretty big, Marina, because as we both know, there's a lot of trial and error, right?
There's a lot of trial and error. So 67% of patients will fail to respond to their first treatment, and up to a third will fail to respond by their fourth treatment that they try. So there's a really big need in this area.
That's a really good way to sort of have a high level sort of interest statement. So that's one of the main reasons why we invested over here at MEDTEQ. So we actually led Aifred's most recent round back in, when was it, Marina? December of 2020 now it is. No, 2020. So so we were pretty excited about Aifred because, it can really change the workflow for psychiatry, at least for the beginning. We do think, so where do you think this is going to go? I know there's a few other, maybe just drop a few other indications because, mental health is really huge. Psychiatry is a big deal. Obviously, there's a lot of spend going there. The workflow itself is pretty hasn't really changed much in the past while. Ben, you're going to really change all of that, and that's why we invested in the first place. But, just sort of blue sky thinking, where do you think Aifred's going to be going? Maybe just give us a few indications here and there to help us understand how big this opportunity really is for Aifred.
This opportunity is huge. Depression is the leading cause of medical disability in the world. So just starting with depression, you're tackling a massive problem. Anxiety is very close behind it. In some markets, it's actually even more prevalent, such as the US. So anxiety is obviously another huge area of mental health that needs to be addressed. But there are others that are very costly to the healthcare systems that support patients. Bipolar disorder, schizophrenia. These are other indications which certainly need the type of technology that we've developed.
That's incredible. So this is exactly why we invest over here at MEDTEQ. So we saw this sort of big, well, obviously with Marina's help and her team, but we saw this huge opportunity, of course, right? But it takes a long time to get there for sure. So, one big thing about us for Canadian health tech startups, angel groups, non-dilutive capital, it's a really important line item on the balance sheet, on the P&L, right? So I think you got a bit of support to get here, is what I'm trying to ask you. So what kind of non-dilutive support did you sort of get in the super early days before, folks like me showed up at your doorstep and said, hey, why don't we do a deal?
Well, actually, MEDTEQ played a role in a lot of our non-dilutive funding. So it's helped us in some major stages in proof of concept, making sure that we got our prototype product into pilots with healthcare institutions very early in our development cycle, so that we could understand and we could learn what the needs are, what the clinical workflow is, and what would make the tool engaged and usable within a clinical setting. And that has been tremendously important for us, because this enabled us to refine the product itself, but also have those proof points in hand when we went to investors to ask for dilutive funding. So the support that MEDTEQ has given early stages of Aifred's development has been huge to make sure that we could hit those proof points we needed to.
And let's not shortchange Aifred right now. What you're the first in Canada for what now?
So right now we are #1 in North America and #2 in the world.
There you go.
Or that's totally fine. #1 in Canada, number 2 in the world, for the Global IBM Watson AI X Prize, and we were competing with our model for personalized treatment selection, an AI-based model for personalized treatment selection, as one of over 100 companies from around the world representing AI in pretty much every field you can imagine. So we are very proud to have been recognized through that competition. It was a long competition, 5 years. The team has worked incredibly hard, and that competition closed just a couple of months ago. And that's been a really good boost for us as we prepare for the launch of our clinical trial this fall.
That's amazing. So #1 in North America. That's some good marketing over there. And look, we're really proud of you folks at Aifred. Obviously, you know, as ourselves, that, you know, we co-led your recent round with BDC Capital. So you got some pretty good investors in the company. So we all believe in you. And we're looking for some amazing things to come.
We're really grateful for your support. It's been a really long and great partnership with MEDTEQ Plus to date, and we're looking forward to taking it forward together for months, years to come. We really appreciate it.
Amazing.